Hello and welcome to a brand new episode of Health 360. On the show this week, we are addressing a problem that has barely even been recognized. Over-exercising is a real concern and it can cause irreversible damage. Also on the show, what is the truth behind actor Tamanna Bhatia's saliva pimple cure claim? What is the link between blocked arteries and a high-protein diet? That much more up ahead on the show. I'm Sneha Mordani. This is Health 360.
If you have increased proteins beyond what is required in your body, excessive protein intake can be pro-inflammatory and cause the vessels to rupture. If you have a substandard proteins, which are actually mixed with performance-enhancing drugs like steroids, anabolic steroids, or even heavy metals or preservatives like aspartame, sucralfate, all those things can actually damage your heart, cause arrhythmias, abnormal rhythms, and can be injurious to your heart.
So can protein powder inflame you? Studies show chronic low-grade inflammation is linked to protein excessive consumption.
The problem arises if you overshoot it, then it becomes inflammatory, or if you use a substandard quality, non-third party tested, any international brand which is there which has not been tested properly, which contains a lot of performance enhancing drugs like steroids, like anabolic steroids, or like other preservatives like aspartame, or probably like sucralose or emulsifiers to make them thick, can be dangerous and deadly.
Doctors also indicate that key signs of poor heart health may go missed. Blood pressure may remain normal. So will cholesterol.
Our blood vessels are lined with endothelial cells. Imagine your blood vessels are like a smooth road. And suddenly, because of stress, because of inflammation, there are potholes, like you have potholes in a city. So you have potholes. So these potholes are basically a fertile milieu where the body tries to cover these potholes with formation of small clots. So these clots cover the potholes, and these clots ultimately result in blockages. So once the blockage to the heart occurs, the heart muscle starts dying, which is called as myocardial infarction or a heart attack.
Excessive protein from animal sources and overuse of protein powders is what doctors warn against.
So what excessive proteins do beyond a certain level, they are pro-inflammatory, they cause plaque rupture, and as a result what happens is they cause increased blockages in the heart if you go beyond a certain amount of protein levels, number one. Second, in the diet, if you increase the amount of proteins or increase the amount of fats, let's say gym trainers are telling you to eat 10 eggs, 12 eggs, which is not physiological. You don't require 10 eggs a day. So if you take too much of protein, that will burn up your kidneys.
So is plant protein safer?
Plant-based proteins are less inflammatory as compared to animal-based proteins. Plant-based proteins can be from pea, can be from soya, can be from chanas, and these plant-based proteins are less inflammatory as compared to the animal protein counterparts.
Build-up of arterial plaque and increased risk of heart disease are linked to protein. There are half a dozen studies done to establish that link. But it is a problem that needs more attention, given how increasing heart attacks in young Indians has caused so much concern in recent times.